All right, everyone. With that, I think I'll go ahead and get started. Just a few things that I'll share, and then I just want to show a few brief slides. But first of all, I want to welcome everyone to what I hope is the first of many discussions around Black wellness. Special kudos out to Dr. Rakel for just the interest in partnering together, for the wonderful research that you're doing, and for the willingness to find out how it intersects with our desire to see greater Black wellness in our community. I'm also very grateful for Dr. Hampton for being here and for sharing in this presentation as well. And I believe that this is going to be just wonderful interaction. We're recording it so that those who can't be here can still benefit from this information, but I'm hoping that this is the beginning of a true town gown partnership, as we used to call it in another life, when I was a special assistant to then Chancellor David Ward for Minority Community Relations. We endeavored to find meaningful ways for the university community or other systems to connect with the community. My name is Dr. Alex Gee, lifelong Madison resident, pastor of Fountain of Life Church. I created the Nehemiah Center for Urban Leadership Development 30 years ago. And I'm now the founder and CEO of the Center for Black Excellence and Culture. And but for folks here who read theroots.com, particularly for my Black colleagues, you know you've arrived when theroot.com covers your story. And I appreciate the fact that they referred to this project as a dope ass project, end quote. I feel like I've really, really arrived. Here's my passion. So many things that are attempted in this community, meaningful things, either don't involve Black people, particularly things concerning Black people, don't bring us to the table. The other thing is which means other people are designing solutions for us. And another thing that I've realized, and all of this is sort of the impetus to creating this center, is that there is a need for collaboration. And I have a strong affinity for just humanity. And within that, people of color, because we have similar struggles. But Madison has a reputation of not allowing a collective Black brilliance to emerge without it being co-opted, if you will, for a broader sort of agenda. And so as I've listened to people, 35 years as a pastor, 30 years as a nonprofit leader, parents of my former students, when I recruited for UW, they asked, what is there for Black people and where can Black people go? Fast forward, now there's science out here about microaggressions and social determinants of health that's saying that because we have not answered those questions, our lives are now shortened. I got a problem with that because I think if nothing else, Black people ought to get an extra 20, 25 years in our lives for just what we've been through for the last 400 years. And so to see shortened lives is very concerning. So it's not just about Johnny or Jane not reading or performing at their appropriately great levels, but it's the thought that their parents and grandparents aren't living full lives. And particularly because these are diseases, many of the diseases are stress related. My mom suffers from dementia. It can be caused from a number of things. And I serve in the Alzheimer's Research Black Brain Health Committee. And we're now understanding that things like diabetes and hypertension are leading indicators for dementia. And so I'm starting to have these discussions about what does wellness look like that's not just curative, but what does an environment look like that breeds wellness? And I believe that it has important role in our community. You know, last year we talked a lot about the Tulsa riots. It was the 100th anniversary and how Black businesses were destroyed. But we didn't talk about the cultural destruction of Tulsa. There were beauty parlors and barber shops and bookstores and playhouses that were also destroyed. It wasn't just Black economy. It was the destruction of cultural places that gave a sense of Black confidence and competence that undergirded and supported Black business. Black business did not exist outside of Black culture. And that the combination of those two created a great sense of wellness. And so to have greater access today as a Black male, but worse health than my grandmother is problematic. And it's not because I don't have health care, but there are issues like microaggressions and pressure and stress. And I'm just interested in finding and being in pursuit of what helps us to heal and work together better. And so I just want to show a few slides. What I've noticed in this community that I love, that gave so much to my mom 50 years ago when we came here, is that many of the discussions around what the Black community needs are focused on surviving and not thriving. Black people want to thrive because we've worked here and we've helped to build this community. There's a deep concern to make Madison become a place where Black professionals want to live and build their careers. We can afford the property, we can even afford the taxes. But the absence of cultural reinforcement, I refer to it as when you go to someone's home and you see pictures of family members, but you notice the youngest daughter is missing or the oldest child is missing, you wonder, am I missing something? Is there something that someone didn't tell us? You expect to see the whole family. If Madison were a hall, so to speak, you don't see the photos of his Black children, of his Black patriarchs, of his Black family members. That says to people, we haven't contributed, we haven't been here, and it says to us, we don't fully belong here. But yet, we're there early, we stay late, we're committed to the jobs, we're committed to the tasks, we're committed to the communities. But in working diligently in these areas, we bump up against these microaggressions that weigh in against our health. We pay for it dearly. I want to do more than just talk about that. I want to find and create places that are free of that space. And so as I've listened to hundreds, and I'm talking about hundreds and hundreds and hundreds of Black influencers in this community, a number of things came up. That one, we want to focus on the Black diaspora, folks from Africa, the Caribbean, folks who identify as Afro-Latino and North American Blacks. We want to talk about our contributions, and we want our pictures on the mantelpiece. We want our children to see, we've been here and we're going to be here, and we built here, we invested in here, and we have a right to be celebrated here. A space where there are theaters and performance spaces and spaces for innovation and spaces for seniors and for young children and spaces for grad students and professionals to come and interact, book nooks, libraries, a lounge, so that we can entertain and receive our lecturers like Dr. Hannah Jones, who may come to Madison. We can receive them in our community to have a real family feel. We know culture is important. It's why we put so much money into downtown cultural centers. Every major city has something downtown, a performance center, an art district, because art reinforces your sense of transcendence. And it proves that you have been here and that you've been able to rise out of the ashes. That doesn't exist for Black people. And so it's easy to think that our history begins with the transatlantic slave trade, and it doesn't. Or that we've always suffered or dealt with deficiency, and we haven't. And it doesn't tell of the strength and the beauty of our culture so that we can reinforce ourselves and our children, but also people who don't look like us. We want them to know the benefits of this as well. The center is led by and for the Black community. Black folks have spoken into it. Our architect is Black. Our landscape architect is going to be Black. Our interior architect is Black. Furniture makers are Black, because we want this to drip with a Black aesthetic that says to the community, you deserve to be here. And we need to do it in a way that is not remedial or as a second thought. And we want to create space that empowers Black excellence, because we know that when there's space, whether it's a coffee shop or whatever it may be, a bookstore, when we're together and we're not battling microaggressions, we're not thinking about being the first and the only, we can exhale and decompress. And that space creates room for mentoring and gathering and leading and celebrating and healing and incubating and dreaming. And it gives us space to create our own solutions. And it gives us space to build leadership from a perspective of our transcendence and to motivate people out of that sense of transcendence and to gather people out of the sense of Black excellence. And then we can share that with the broader community, because when we have a home, we can invite others over to see it. The center will focus on leadership and innovation, history, culture, and gatherings, and performing arts. I just want to show you just, this is the shot from the Beltline, but let me just show you the inside shots. Top left is our lobby with innovation space upstairs and the theaters downstairs. Top right is the private lounge that I'm affectionately referring to as Club Afrique, so that we can entertain dignitaries when they come. All of the furniture in here is from a Black furniture maker that we've been interacting with, just to understand the colors and the feels and the shapes and the material will exude our great history and culture. The bottom right is the outside section of that terrace. Weddings, receptions, graduation parties, retirement parties can take place. This looks to the southwest over the Beltline. And then the bottom left is a theater, seats 250 people. We can have comics, lectures, plays. We'll have lighting for that. We'll be able to cover the windows. With a hit of a button, the seats retract so that this can be a place for banquets. And we're doing all of this because we want to help promote the lives of Black people. Because for me, culture isn't just what we look at on a wall, it's what happens inside of us so that we look at our world differently. We have people who love so much about Madison, but don't feel like it's home because it doesn't reflect us. When I interacted with Jerome Garrett, and he will introduce me to Dr. Rakel and his team, and found out that there was research being done that shows that when certain aspects of personal and professional development and spiritual revitalization and laughter and meditation and nutrition and healthy, and well, that healthy eating is nutrition, that those things can be proven to enhance wellness, it floored me. And so I'm excited to have this space to begin talking about the merging of those two things. When we talk about wellness, we're not necessarily talking about a site for vaccinations and those kinds of things. That's very important. But we're talking about a space that in itself promotes wellness because it inoculates us against the microaggressions that many of us as people of color, as Black people, are experiencing on a daily basis at work. And to have space to dream and collect and collaborate and meet each other and celebrate and to educate and to grow and groom leaders, I believe is what we're really looking for. And when we can become our best, then and only then can we give our best to the communities. And so my job is to lay out the vision for the center, to create a place that has a beautiful Black aesthetic. But the ultimate goal in having these celebrations in the space is to promote an environment where Black wellness is experienced, and Black excellence is what we're about and how we promote and do everything that we do. So with that, I'm going to pass things off to my new colleague, Dr. Rakel, who's going to talk about some of his research. I'm excited because this is the first time I've been able to take a cultural dream and have a partner tie it to the salutogenic sciences behind it. And I think this is really, really exciting. So with that, Dr. Rakel, I appreciate the work that you've done and your willingness to think creatively with me and with us in a way that promotes the lives and the health of some of the dearest people in this world to me. And those are my African-American friends and colleagues in this community. So with this, Dr. Rakel, I want to introduce you, pass the mic over to you, and thank you so much for your partnership and for your work and your scholarship, sir.
Wonderful. Thank you, Dr. Gee. It's such a pleasure for us to be here with you all so we can really explore the science of creating Black brilliance, that thriving that we want to create for all humans, but particularly in this center to help us both achieve what you just beautifully described. So I'm going to try and be fairly brief because I want to make sure that Dr. Hampton has a chance to share her passion. So it's a kind of a hard word to say, but we want to create a science of Slutogenesis, salute, health, genesis, the origins of. And that's a little bit different than the pathogenic science that our medical culture has gotten somewhat accustomed to, which is a good thing. We've done a lot of wonderful things. But I always like to start with this activity to have you put your hands together and just look down and see which thumb is on top. And I have my left thumb on top. You might have your right. And then just slowly take all your fingers and put the other thumb on top, as well as all the other fingers, have them equal up, interlaced, and get a sense of how that feels. I would guess that that's pretty awkward. And the reason it's awkward is because we haven't been conditioned to have that thumb on top. We've always felt a sense of comfort with the other thumb on top. What we need in healthcare today is to start to feel comfortable, to condition the mind to think about how we can find what's good in people instead of just what's wrong with them. And that's the challenge and the process that we'd love to work collaboratively with. So in every living thing, we have this complexity, this beautiful biopsychosocial spiritual complexity that requires a holistic view. And Slutogenesis is much more than just looking at the broken branch on the tree. It requires us to look at the roots of what creates that center for vibrancy, that center for cultural awareness, that center that's healthy just when you walk in the door. And that requires us to look at many different aspects of health, including all of these key ingredients that every human being needs to be healthy and resilient and to thrive. I love to use this graphic to describe this because this graphic in the middle is all the intelligence, computer intelligence, that goes into one Facebook post. So when you post something on Facebook, all this science, all this technology works through this whole network to do pretty much one thing. And that one thing is to sell you something. And it feeds you information for you to believe that you know everything you need to know. So it actually creates this separation between humans. We've programmed this to really divide us. And pathogenic science, pathos to suffer, genesis, the origins of suffering, we've kind of simplified it into this linear process. Here you've got this symptom, take this pill. This has resulted in a rather expensive, ineffective healthcare system that isn't a system and it isn't either. It isn't healthy. But what if we took this same technology that's depicted in this graphic and we used all that intelligence to help people be healthier? We can do it. We've got all this capability, but we have to shift our intent to put that other thumb on top. And when we look at the complexity of this graphic or that human being, we use our humanity to find a pattern that serves their best outcome. And that's a different type of science that we want to do together. And that's salutogenic science. So I put this right in the middle because I didn't want to forget my partners. I bet this group of people could make the world spin faster if they put their mind to it. I'm so privileged to work with these and many others. But in the upper left is Greta Kufal. She is on this call. Her and her team just was awarded a $5.5 million endowment from the Osher Foundation that's going to allow us to organize group visits, particularly with attention to the most under-resourced communities here in the Madison area. And next to her is Jennifer Edgu. She's my executive vice chair. She leads our Office of Community Health. She's also our vice chair for health equity, diversity, equity, inclusion. And her partner to the right is Shelley Shaw, and she heads up our Office of Community Health. And those two together are really reaching out and first asking our community partners how we can best serve you, and then responding to that ask. And I'm so excited to have Elise Ward, Dr. Ward. She's my first 10-year hire, and I couldn't be happier to have her on board. And her excellence is mental health in the Black community. And so she'll be starting this summer with us. And then my partner in, I was going to say crime, but the partner in health is Jerome Garrett, and he is such a joy to work with in regards to, he does everything I do poorly, like math, as well as many other things. I'm really looking forward to the fun and productive career we'll have together. So these are people, just a few of many that I think we can really partner with you to really create that center of vibrancy. So I want to just share with you one of the research projects our department started on way back in 2013 with the largest healthcare system in the country, the VA health system, which is a beautiful system to work with because it's like a little Norway. Everybody has access to care, and it's a confined system that it's easy to do research in. And The main intent was to change the conversation for the veteran. Instead of asking the veteran, what do you need from us? We asked, what's important to you? What do you want your health for? And so often in healthcare, to use diabetes as an example, we just focus on the lab tests like the hemoglobin A1C. But if we focus on what's important to the human being, what matters to them, that has a domino effect that just has health outcomes one after another. It leads to empowerment, motivation for behavior change, sustainability, and healthy outcomes. And one of my favorite quotes is, a definition of hell is a place where nothing connects with nothing. And if we're going to create a healing environment, we want people to connect in a kind and compassionate way. So what happened when, oops, sorry. Okay. This is the mandala that was used when we worked with the VA, and it's still happening. Your tax dollar is working hard on facilitating health for our veterans. And the first thing that is taught is mindful awareness in the present moment, to drop in and ask, what's important to me, the veteran? And you can do this for yourself. What do you want your health for? And then after we drop into meaning in our lives, the next question is, you know your body better than I do, or better than anybody. There's these 8 core ingredients that every human being needs to thrive, to be healthy. So tell us where you need to start. What do you need the most support in achieving? And then once we know where you need to start, then we recruit our interprofessional team to support your best outcome based on what's important to you. So you start with the self, we understand where we need to start, we recruit the professionals, we create a healthy community, and that results hopefully in healthier outcomes. Does this have an effect? Look at pharmaceutical costs for those veterans who received this whole health model, where they asked them different questions. What do you want your health for? Versus those veterans who did not. Significant reduction in pharmaceutical costs. And one of the things that we've done in healthcare is based on having the comfort of that comfortable thumb on top, we got into this habit to prescribe a pill for every ill. And to think that we can treat suffering with something like an opioid is so myopic, is so nearsighted. But we did it because that's how we were trained and that's all we knew. And that led to an opioid epidemic before the COVID epidemic. And what is an opioid for suffering? It's a temporary, inauthentic glimpse of bliss. It's not real, right? It's a temporary glimpse that removes our suffering, but it's not real, so it doesn't last. When we ask veterans what they want their health for, opioid prescribing went way down. Opioid utilization went way down because we reached into the human essence and pulled out what was important to them. We pulled out meaning in their lives, and this reduced costs and increased the quality of care. And if you look at those over 50 who have a high purpose versus a low purpose in life, those who have a low purpose in life are 2.5 times more likely to die prematurely after age 50. This matters. So I wanted to end with this fun study. This just came out last week. And it's a fun study because it's looking at the effects, the power of open label placebo. So what open label placebo is I'm going to give you a sugar pill. This has no medicine in it, but there's good evidence that sugar pills work. And then for this study, they looked at kids and adolescents 8 to 18 years of age with IBS, which stands for irritable bowel syndrome. So that's painful abdominal spasms. And when they educated these kids that they were going to be taking a sugar pill, a placebo with no medicine in it, that has effect, it reduced the frequency and severity of their pain by 50%. Open label placebo, no trickery. I'm giving you a sugar pill. And they looked to see who was more suggestible. Often in this placebo research, we say, okay, some people are more suggestible to the placebo effect than others, but they looked for that and found no difference in any of the subjects. But what they did believe is that the education about the power of placebo influenced the outcomes the most. So how we educate our youth matters. So what if we educated our youth like this in your center and all schools at a young age? And we said, everyone, just like the power of the placebo, everyone deserves the right to be perceived as they choose. In valuing our differences and our diversity, we share a common humanity, offering respect and dignity to all. What effect would that have on the health of populations far and wide? So I hope in your center, and it sounds like this is something that is so exciting, that you can create a health trap, a place that you can trap people to be healthy instead of a disease trap. How do we create a health trap? And that requires different types of intelligence, social intelligence. The main predictors of health is your zip code, unfortunately. You know, talk about health equity. If we're really dealing with health equity, we would have everybody have the ability to thrive and be vibrant and be healthy. So that requires social intelligence, which also, and no, this is not an oxymoron, requires political intelligence. We need policymakers to make social intelligence more applicable. Now, with the computers, they're going to be doing a lot of things that we used to do, but it's going to free us up to do more human things. Artificial intelligence, we'll have wearables that will tell us what our blood pressure is all the time. All that data will be downloaded into a computer, and that's going to give us so much big data that's going to help us do health better. And most importantly, it's going to protect humans to be more human with each other. And that's where authentic intelligence comes. And that's what humans do best. We recognize patterns within complexity. We recognize patterns towards health within context. And that's not linear. That's not A to B. That requires us to be human with each other. And that health goes both ways, from you to the other person and from the other person to you. And simply, that's the right thing to do. That's the moral intelligence. And speaking of moral intelligence, I'm going to pass off to my colleague, one of the most gifted physicians I know and teachers. I just spent a weekend with her learning Zen leadership, where she taught me all sorts of skills and techniques to be a better leader. So Adrienne, Dr. Hampton, you just tell me to click and I will click to the next slide.
Dr. Rakel, thank you for that lovely introduction, for the introduction of the Health Haven. So I'm Adrienne Hampton. I'm a family doctor here in Madison. I did my residency here under the kind, careful tutelage of Dr. Rakel. And when I finished residency, I enjoyed working with him so much till I signed up with the Integrative Medicine Department to do fellowship here in holistic health. And now I am faculty at the Northeast Family Medical Center, where I get to practice in that way in a community that I love. And so I am thrilled to be here as a Madisonian at this point, as a Madisonian doctor. I am coming from a health perspective, and I love that we are bringing together this center for holistic health. It's a beautiful thing. And so I was talking with my dear friend Greta, Dr. Kufal, who was like, you really should be up on what's happening because I think you'll be interested. And she started talking about the center, and she started talking about what, the plans that were afoot. And then I kind of just started gabbing. I was like, what if this, and then what if we tried this, and then what if, and she was like, okay, well, you need to talk to these people. And so I am so grateful for that connection. And you know, in that brainstorming that I sort of spontaneously put her through, one vision came through that I just want to share as you know, as someone who's in primary care, who does maternity care, who loves working with Black women during pregnancy and beyond, and who sees a particular problem in Madison. This is one concrete example of how I think a center like what's being proposed could lead to more health equity and better health outcomes for our beloved community. So I'm going to use the example of preterm birth and pregnancy care to demonstrate what I think a center like this could be. So, you know, we'll start with where we are. Black infants are 40% more likely than white infants to be born preterm. And we know that preterm birth is a major driver of Black infant mortality. So that's where we are. Next slide, please. So, you know, in healthcare, we want to help, and we say things that we know to be helpful. So we say, Black women, reduce your risk of preterm birth, lower your stress level, get yourself a doula, quit smoking, eat a healthy diet that's rich in these things, get your aerobic exercise. And that all is evidence-based. But what we're interested in the model that Dr. Rakel was sharing, the whole health model where I'm at the center and then my clinician is partnering me and asking me, what do I want my health for? And where do I want to start? You know, we need a way to make the evidence feel less like a to-do list and more like an embrace. And that's what the center feels like to me, is that embrace. And so here's a way that I think we can start. Next slide, please. So in a clinic, right, I can offer appointments. I can help you make an appointment. If there's a center where art and culture and connection are celebrated, then all of a sudden I can start extending invitations. And so it's less of a to-do list, check, 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 check. It's less of making appointments, right here, go here, go here, go here. And it's an invitation all of a sudden. And doesn't that feel different? That starts to feel like that embrace that we want to make of the evidence. So instead of saying, Black women here, fix it, we say, you are loved and connected to spirit in your beloved community, and let's see how that could play out. So next slide, please. So what if, here's my brainstorming, what if instead of saying, you got to work on your stress, what if I could extend an invitation to a prenatal yoga class designed for Black women in a place that feels like a second home? So all of a sudden, I can extend, I love, the chat is live. Yes. Yeah, so instead of saying go to a class, you know, I'm picturing myself, whole health model, me at the center, I'm picturing myself at the center. Maybe they let me teach this class, or maybe I'm just hanging out and I see the parade of pregnant ladies going to this class, and doesn't that warm? Yes. Doesn't that warm my heart, and doesn't that start to feel like the connected embrace that healthcare would like to be? Next slide, please. And then, so we're lowering stress levels, we're gonna get some exercise, and what if, again, instead of saying, oh, the Y is running a special, you should go to the Y, they have a prenatal exercise class, what if I could extend an invitation to dance in a way that is celebratory of their specific circumstance? What if we partnered with our community members? Do you know there is at least one griot in Madison? Manjumara is a griot bona fide from Guinea, West Africa, who blesses us with teaching and brings teachers and teaches drumming. His partner teaches dance. And I've had the good fortune to study with them for a long time. And that doesn't make me an expert, but it makes me privy to the fact that we could be dancing in ways that are specific and linked to culture and heritage for the specific circumstances of childbearing and fertility and transitions. And that could be the exercise that in the clinic I'm asking women to do, you know, that deep, connected, restorative movement that is so much more than, you know, like a jazzercise. Next slide, please. So when we're saying that pregnant women's birth outcomes are better, preterm deliveries are less when they have a doula, wouldn't it be lovely if these could be casual contacts, if there was the community feel where you didn't have to go to a specific place to see your doula, and then you didn't have to go somewhere else to get your exercise, and then you didn't have to go somewhere else to do your group medical visit. But what if these things were just baked into a place that felt like a place where you belonged and wanted to spend your time, so that you see your doula in that dance class and you're relaxing and networking and enriching your lives together, because it's not just sort of there's not this disaggregation of the health promoting places, but the center is the health promoting place where people interact in ways that are healthy. Next slide, please. And so that multidisciplinary group visit that we know leads to fewer preterm births and better birth outcomes could also happen in this place. And it could be down the hall from your prenatal yoga class or the dance class that you were just at. And you could move as a cohort, because we know that those cohorts are health promoting. And so you could conceivably be in your group visit and then hear the drums down the hall calling you by your specific drum call that you know and recognize, saying, hey, it's time to move. Like, this is what could be possible in a place like this. Next slide, please. You know, and then the list of vitamins and minerals that we are asking our our pregnant women to take is always growing. And it is one thing to give people a sheet that says, you know, you need this many micrograms of this, you need this many milligrams of this prenatal vitamin will get you most of it. Here's a list of iron-rich foods. But what if we could cook together? And what if we could cook together in a way that felt like an event? So not like oh, I got to do this, but oh, now I'm going to go cook with my friends, you know, and we're going to make an evening of it. And yeah, it's going to be healthy because somebody thought about that, because somebody cares about me and my pregnancy and wants this to go well for me and understands that that list of nutrients is kind of boring. And so they've taken care of that. And so I'm just going to go learn how to make something delicious with my friends, and then we're going to eat it. Or, next slide, please. Somebody already made it. So I'm just going to pull up a chair, because I'm tired and it's the end of the day and it's time to just relax. And I know that this night is for me, or this afternoon or whatever time is for me after I have done my healthy things at the place where I go to relax and network and connect and enrich myself. Now it's dinner time. So it's, what inspires me about this is just this feeling of wraparound care and connection that comes from within us, within our community. The community makes the center, and the center is a home for the community. I'll stop talking. Thank you. I understand next is a Q&A.
Dr. Hampton, Doctor, listen, your employer better hold on to you before I go out here and find another $1 million and steal you from wherever. Before I make you a deal, you can't resist. You gotta tell your parents you left medicine to go into nonprofit work. That was, oh my gosh, that was just so powerful. Dr. Rakel, Dr. Hampton, I just want to say thank you so much just for the space to dream together with the community, rather than saying, this is what you people need. The fact that you're willing to build on with this vision, with salutogenics, and with applicable and culturally relevant ways of helping to address things like infant mortality rate is just fantastic. So let's open up to questions. We've got about close to 15 minutes just to address questions. You can either unmute yourself. I don't know, Mr. Fleming, are you helping who's helping us to find out who's raising their hands? You can either raise your hand so we can call on you, or write it in the chat room, or just unmute yourself and ask the question. And in the meanwhile, I'm going to be dropping links to the center for people who just want to know more about our work. Questions? Sorry, let me get the gallery so I can see more people.
I would just like to say how exciting, how wonderful what I'm hearing. I am not a Madisonian. I've been here about 20 years now. Came in from New Jersey, but I'm from the Midwest. And I'm now 70, and I also am in the program, the Alzheimer's Research Center, as in one of the cohort groups. So the idea of the aging population is really important to me. I mean, I also have a daughter who today is 8 months pregnant. She's in Ohio, and she just found a Black doula. She is so excited because I can't be with her. And the idea that, I mean, that as you were speaking about this, so I'm thinking on one level about seniors, older adults, but then this was really speaking to my heart with what I'm dealing with right now, to feel like she's so not connected to a family because she's out there, but to have something like this for so many of our young women who are feeling disconnected from their families who are even in town, to have a place and a space to be embraced, to be not just going to a visit or a clinic or one, you know. So what I guess my question is just kind of from early age, like the infant mortality issues and things until death. You know, this center seems like it's going to encompass a lot of that. And I'm just to speak to a little bit of the whole age range of what you're hoping the center will accomplish and what will it be. But I'm hearing really great things, like so many things that I would want to be there for.
I love what you're saying, ma'am. Thank you for sharing that. Someone put in the chat room, 20 years makes you a bona fide Madisonian, ma'am. So we just wanted to just state that for the record. I would say we're at a beautiful juncture in this center, ma'am, where part of this listening session is to hear from people and to hear what you want. And so if I can turn your question into a suggestion, I hear you saying, we want to make sure that this is from cradle to senior and seasoned years. We've been having listening sessions. We've been very fortunate to have Black medical professionals speak into this at every level excuse me, those speaking into the physical design of the building and even the purposes have been hundreds of Black individuals, tenured faculty, medical professionals, teachers, formerly incarcerated, moms, Madison-born Black young adults, that I mentioned faculty, nonprofit leaders, business leaders, in order to support the fact that, yes, we need this. In the next step, we're going to need people who are interested in this wellness component to speak into the programmatic piece. That has not been designed yet. And so I wouldn't do to my community what's been done to me. Here's a blueprint, we're going to do it. Everybody rubber stamp so we can say that we've got community buy-in. And so I just dropped an email in here, info@theblackcenter.org, so that people can email us and say, add me to your list, because when you start, because in the next month or so, we are going to begin talking about what does this space look like what Dr. Hampton was talking about, like moving, from doula meetings to movement meetings and yoga meetings to dinner. We're at the stage where we can make some of that happen, but as we spell it out, and then we have the science that Dr. Rakel has shared and his team has shared, and then we have the backing of Black medical professionals, that helps us to go to the health systems and say, do we just want to work on the back end, or do we want to prevent some of this? And so the input that will be happening next positions us to go and get the resources to make sure that this center has what we need. And if we are limited by the 65,000 square feet space that we have, we will do what we can, but we will spill out into the rest of the community and prompt other entities to do similar work. And so please, if you're interested in being part of all discussions, you can go to our website, and I'll drop that again. It's theblackcenter.org, or email us at info@theblackcenter.org, just saying, we want to make sure that we want to, or I want to be on your mailing list, or I want to be part of those listening groups. We would love for that to happen, because that's what's going to make this truly rich, that the community has spoken into this. And this, for many of you, is your expertise. It's my vision, but I need the expertise like that, which Dr. Rakel talked about, or Dr. Hampton suggested. Those are the things that gives this a crisp edge that will just capture the imaginations of funders of the health systems, locally and abroad. We need you all to help us shape this.
I would also
and
just
we deserve it. We deserve it. You deserve to have a space after serving this community, to be around art and culture and young people and innovation. That's a benefit of having served in this community. And I feel like it's my responsibility to make sure that people who have served this community the way you have, the way my mother has, the way others have, to make sure that you can finish in this community in a way that's meaningful. Dr. Rakel?
Thanks, Dr. Gee. I was just going to say, Barbara, this is also a place where generations can come together, and never underestimate the power of cross-generational healing, and how an older wise person can mentor or support or even provide daycare for a younger mom who has to go to work or would really love to enculturate their child in this center. I think the power of that cross-generational support is so powerful. Dr. Hampton, you might have some more thoughts.
I just agree.
I see Dr. Edgoose, who Jennifer, you may not have been on earlier, but Dr. Edgoose directs our Office of Community Health, and is, as I said, also our Vice Chair of Diversity, Equity, Inclusion, and Health Equity. So I will recruit her to also help us answer questions.
I'll just say I'm actually at Northeast Clinic right now. It's just a privilege to be here with all of you, and a lovely way for me to end my day is to hear Adrienne Hampton speak. So, and Dr. Rakel. So, I'm very excited to support the future of the center.
If I may have a moment here to add, Rev Dr. Gee, I mean, we kind of go way back in the community, but I also just wanted to let you know that as I moved to my faculty position in the Department of Family Medicine and Community Health, that I will be very open and available to connecting with you more on this work. As you know, I'm a licensed psychologist, and my work is always focused on African Americans, mental health, and I've done my work using a community-based participatory approach where I connect with the community and stakeholders in the community like you to move this work forward. And as Dr. Hampton talked about, where do you do this work and how do you engage with folks to do this work in spaces where they feel most comfortable? I've been doing my depression work and partnering in the African American community. In fact, I developed a faith-based depression intervention. And if we're able to get funding and test that intervention, your center would be a great place for us to partner to deliver mental health care on site at your space where people feel safe and comfortable. So I just wanted to put that out there as well.
Dr. Ward, thank you so much for putting that out there. And that's the beauty of this space. We have the collective brilliance in this community. We have the wherewithal. We just haven't had the physical location and the agency to really create it in a way that has a strong cultural lens. So thank you. Thank you so much for that. Fabu Carter asks, how do we find doctors who support this type of medical care? I like asking a person what they want for their body. She liked that point in that question. So she's asking, where do you find doctors like that?
Dr. Kufal, you want to take that? She might, I'm not sure if she's available. Or Adrienne, you could take that one too. There she is.
So go ahead.
So our program has an integrative health fellowship program, and this is sort of the model that we follow, and this is what we teach. Our clinic at the Yahara Integrative Family Medicine Clinic in Monona, that's sort of how we center our practice. We have a consult clinic at UW Health Research Park, but our goal is to sort of expand that into these spaces that are, I cannot tell you how incredibly exciting it is just to hear you talk. And Adrienne, I have never in my life been around or heard words that just felt more exciting and true and what is needed as I saw you light up and talk about what your vision could be for that. So just wanted to say that. But in terms of physicians, we have a practice like that. We're working on changing the culture of medicine in general as well, and making this model available to as many people as interested. And there are pockets of people interested in this type of medicine within UW, and we're hoping that our Osher Center for Integrative Health will allow us to spread that type of care, that model of care more broadly.
I would love to see a model of community-based or education where community members could meet with medical students or residents or folks in fellowship to give a community-based expression of what fair treatment or good medical treatment feels like to us. Years ago, we were, my nonprofit was contacted by Chief of Police, and I'm so sorry, it's the end of the day, so I'm forgetting Koval, thank you. Somebody help me out. Koval, and he wanted new trainees to come in and meet with African-American influencers and parents and say, this is our desire for our kids. We want to put a story behind every face you see so that you understand we need that child to come home. And it was such a powerful thing. It wasn't the police department coming in telling us about the efficacy of their training, but we were the trainers. The community was asked to be the trainers to help them to understand this is what respect looks like to us. And this is what we want you to keep in mind. Imagine if we could do that for people training to be physicians, if they heard from us. I had bad medical experiences where I lived before we came here in Chicago. My pediatrician was Dr. Ordine Torstensen, Dr. T. met him at Dean when I was 6 in 1970. He was my daughter's pediatrician who was at St. Mary's for 116 days because she was premature. And he was her pediatrician. He passed away because of Alzheimer's, and his widow, Ms. Dorothea, is a volunteer in my nonprofit program. So for 52 years, the Torstenson and Gee family have been in partnership because someone taught him how to interact with young Black kids who are afraid to open their mouths because I had a tongue depressor shoved down my throat and I was afraid to do that. It's amazing that when we have an opportunity to create partnerships, they extend for generations. That's just one example. Imagine if we did scores of those and where we learn from each other. And so I just think we have a beautiful opportunity here for us to learn with each other, but for the community to have a role in helping to think about research and helping to think about how we help to train physicians. I work with Dr. Fabu Carter and Carrie Gleason looking at Alzheimer's research. And I've had a chance, and my doctorate is in transformational leadership. It's in ministry, but I've had a chance to author at least 2 papers giving a community-based perspective of what Alzheimer's is doing in the Black community, so that I'm helping to influence the science. I think we can create a precedent of community-based research, community-formed research, using everyday community people to not just be subjects, but to help sharpen subject matter. And so I'm just seeing that the center will influence health and influence health service providers and those receiving the services, as well as those giving it. I think we have an opportunity to do something that becomes a national model. I do see that we're at 6 or 6:01. Dr. Rakel, Dr. Hampton, do you want to say anything before I close out in just a moment? Anything that you want to add?
No, I hope at the very least, Dr. Gee, we just introduced some networking for future collaborations and projects that, one of our biggest missions that Dr. Ed Goose can talk about at length is how do we reach out and partner and first listen with our communities and then use our science in service of their best outcome. So we'll look forward to that. And thank you for the new friendships.
Thank you. Dr. Hampton, anything else you want to add?
Only thank you. I mean, this is so close to my heart because it's for me.
Yes.
And I feel that, and I need that, and thank you.
Well, I'm fortunate that you're here in this community. Thank you. Dr. Rakel, to your team as well, I want to thank each of you for your role. Dr. Ward for being here, and my new friend Jerome Garrett for being here. He's a behind the scenes person, but without him, I wouldn't have had this introduction. And so I'm so glad, again, I've dropped 2 links to our center where you can find out about more of what we're doing, more what we've announced, and also an email if you want to be on our think tank when we talk about programming. So thank you so much. This is recorded. We'd like to send this to you if that's okay, just as a recap to share. And hopefully we'll have another discussion like this down the road. So thank you for taking time out to be with us this evening. This makes me very proud to be a part of this community. Have a good evening. And thank you, everyone. Mr. Fleming, for all the technical support. Thank you.